One doctor has been dealing with hostility and backlash for supporting basic COVID measures. I want to bring in that doctor, Jennifer McKinney, one of only 5 doctors in the small regional hospital in Fredonia. She is getting her COVID vaccine today. I want to start on that high note, if I can, doctor, and thank you for being with us. Talk to us about what it means to you to get this vaccine and for your community to have this vaccine.
Chris, I cannot tell you how excited I am. I haven't been this excited for a really long time. And I will tell you that I am not even as excited about me getting the vaccine, but I'm more excited about my 76-year-old dad, who is one of my practice partners, who's been in this community as a physician for the last 42 years. He's getting the vaccine today, too. And it's just this relief as a doctor, as a daughter, as someone who sees a light at the end of the tunnel, that we're actually here and we're going to be able to do this, and we might actually be okay.
Wow, that makes me tear up. 76, you said? How old's your dad?
Yeah.
76-year-old, a small-town doctor. That's amazing. Here's what's not amazing. You've gotten threatening emails. You were the target of personal attacks on social media because you try to get people to do the right thing. Just yesterday, a Republican mayor in Western Kansas quit because of threats after supporting a mask mandate. If getting some people to take this virus seriously has been so difficult, frankly, are you worried about getting them to take the vaccine itself?
Yes, I am. Here in rural Kansas, in my county specifically, it took until October for us to get our first 60 cases. And then here we are in the middle of December, and we're already past 500 cases. Nearly 200 of those came in the last 2 weeks. And so I think somewhere in the middle, we kind of let our guard down and thought, well, maybe we're going to be fine. It's not going to be as bad as we thought it would be. But now here we are right in the middle of a huge crisis. And I hope that people realize that the vaccine is going to be a part of the solution to help us get out of this crisis. People talk about, there's only 1% of people who die from this. Well, now this 1%, they have faces, they have names, there are grandparents, there are school coaches, they are our neighbors. And I'm so hopeful that people will realize that this is serious and that we need to do something to stop the crisis and get back to real life. I'm going to take the vaccine, like I said. The rest of us in Fredonia, all of us providers are going to take the vaccine. That's the best endorsement that we can give to be able to tell people, hey, we would never ask you to do something that we wouldn't do. So we'll continue to educate. We're going to try to dispel all the misinformation. But quite frankly, I'm nervous about what's going to happen in the meantime until we get enough people vaccinated, because a community like ours cannot continue to see the numbers rise like they are.
Let me ask you one more thing, because we have a map. I don't know if you can see it, but it was compiled by NBC News related to vaccine access. And this is an NBC News analysis of pharmacies identified by the Department of Health and Human Services. 99% of Americans live within 50 miles of a pharmacy that's expected to carry the vaccine, but it drops to 80% within 5 miles. And the red on the map signifies close to 0% within 5 miles of a participating pharmacy. What concerns do you have moving forward when it comes to access to and distribution of the vaccine?
Definitely in our small communities, we don't have the luxury of having a Walmart or a CVS or whatever nearby. Those are at least 30 miles away. And our bigger communities like Wichita, Kansas City, Topeka, those are an hour and a half or 2 hours away. And so I do worry, we have our first shipment and it's very exciting, but when is the next shipment? And then how are we going to get that out to the general public when we don't have the convenience of just walking in and being able to get the vaccine? So I do worry about that. I know that our community, I know we have a strong medical community. I know we will figure it out. But for right now, it's kind of unknown, and we'll continue to work toward a plan to be able to get as many people vaccinated as we can.
Well, we wish you luck with that, Dr. Jennifer McKinney, and I'm so excited for you and your dad to get that vaccine later today. Thanks for taking the time out of your very busy day to talk to us.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.